Pope Francis will undergo surgery for an abdominal hernia in the coming hours. The Vatican says he's expected to stay in hospital in Rome for several days. The spokesman added the hernia is causing recurrent, painful and worsening symptoms. The 86-year-old head of the Roman Catholic Church underwent colon surgery in 2021. Well, let's bring in Dr. Stephen Joseph, who's a general practitioner at the English Doctor Barcelona. He's joining us via Skype from Barcelona. Thank you so much, Dr. Joseph, for being with us. So based on the information given by the Vatican right now, how serious is the Pope's condition in your view?
Well, I think it's a complication of surgery probably from 2 years ago. I think that a swelling, a hernia like that, is not the most complicated type of procedure, provided that there's not a lot of intestinal contents inside the hernia. I would expect that it's something that can be managed and dealt with fairly efficiently, given the healthcare that he will obviously receive.
Right. He's already had colon surgery, and now he's having one for an abdominal surgery. How risky is this for an 86-year-old? He's also had a knee ailment.
Well, he has some ailments. I believe he has knee problems with the ligaments and sciatica. I think the fact that he's been very active in the last week or so, and in fact just before surgery was involved in his usual business, is a good sign. I do think that hernias can cause intermittent pain and distress, but my experience in general is that they respond well to surgical intervention, and we can always mostly expect a good outcome. His age is a factor. Clearly, any 86-year-old having a general anaesthetic, there is some degree of concern. But again, he's having the highest level of attention to his healthcare, and again, all things being equal, I would still hope that things will go well.
What's the timeline for recovery? Can he make a full recovery, or will he need to modify his diet, his exercise and daily routine going forward? He's got a pretty busy schedule later this summer. Is he going to have to change that?
I think a lot will be very clear as soon as he gets back to the Vatican. In other words, if it's business as usual, then everything will pretty much can continue business as usual. Right? Dietary-wise, I'm not sure there needs to be any specific change. This is an anatomical defect in the abdominal wall. It can be repaired fairly quickly. The intestine will continue to function as normal, so he doesn't need to do anything specifically otherwise. So I would expect it, within 3 to 4 days, he could be back on his schedule.
Dr. Joseph,
a week to 10 days, more realistically, in terms of fully back to his usual routine.
So a week to 10 days to fully recover. Dr. Joseph, thank you so much for your time. Thank you for giving us all this information. We appreciate it.
Thank you very much.